So hello friends, I hope I'm audible and visible. Can I get a very quick thumbs up from all my dear students if my audio video is fine? And welcome in this dermatology session. I request all my dear students to just give me a quick thumbs up if my audio video is fine. Now let's start with today's session. I'm Dr. Chesta Aggarwal, your NEET PG educator on the best online platform, that is Unacademy. Now we are starting today's session with a very important information that we are giving a 6-month subscription free if you buy a 1-year subscription. So everyone who is targeting the NEET PG 2023, anybody who is targeting the NEET PG 2023, this is a very good opportunity for them. Or in fact, if you are trying for the 2024 NEET PG, this is a very good opportunity because we are providing a 6-month subscription free when you buy a 1 year of subscription. For this limited time period offer, kindly use my referral code, that is Chesta10. Kindly use my referral code, that is Chesta10. Now we are also expecting a price hike very soon. So if anybody is actually thinking of buying it, it's a good time. You can use my code CHESTA10. Please use this code 10 or call this number for more details, because I don't want anybody to buy a subscription with the increased price. So please go ahead and get your subscription. We have a plus subscription which give you an access to Unacademy live classes from the top educators. You can have an access to recorded and live sessions. You can compete in live quizzes, study on the device of your choice, and you can access around 25,000 plus questions. On Iconic, we give you an access to both Unacademy and Prep Ladder. Now we have special class features where you tend to attend all the classes for free. These are interactive live sessions with poll options, the feature of raise a hand. You'll get the notification before the class begins, and you have lecture notes. You can access this anywhere, anytime on your laptops, on your mobiles, etc. Now recently we have launched an Unacademy Lite subscription which gives you an access to MCQs. Now I hope everybody is following all the exams, and we have observed that the exams have the questions from the topics which is frequently asked. So this practice test series will give you an idea that what are the topics which are frequently asked and where you have to focus more. So requesting everyone to kindly use this code and get yourself enrolled for this Unacademy Lite subscription. Then we have a free test calendar for the FMGE Premier League. This is the session here. You can simply go ahead and get your subscription, or you can just book or enroll your test using a code, that is Chesta10. We have a UPSC CMS batch along with PYQ started yesterday on May 23rd. It's a 1.5 month course with a detailed discussion on the topics like OB-GYN, pediatrics, then we have medicine, surgery and PSM. So I request all of you to please kindly become a part. We are also starting a subject-wise test. So the sessions which we have in the month of May is pathology, radiology, PSM and medicine. In the next month we will have the subjects like dermatology, etc. Now we have a NEET PG PYQ bank, which is a very important or a free live sessions. Now this PYQ bank also consists of the questions from FMGE paper, and you simply get this on your app. So you just need to follow these steps and will get the access. We have also launched auto daily practice papers, where at the end of each class you can actually do or solve some questions related to the topic discussed during the live class. We have separate UPSC CMS subscriptions. So if you want to take the subscription for just UPSC, then please go ahead and use my code. Then we have MBBS Prof 1, very important, MBBS Prof 1 batches. Now here you can use my code CHESTA10 and get yourself enrolled. You can use my code Chesta10 and get yourself enrolled. We have NEET PG subscriptions also. We have NEET PG subscriptions. So if you use my code CHESTA10, you can get yourself enrolled in any of these subscriptions. Now can I get a quick thumbs up from all my dear students? Very important. So let's begin with today's class. We have a lot of MCQs. These are PYQs, and it will be a half-an-hour session for all my FMG students. I request all of you to kindly answer the question in the chat section. Anyone can tell me the correct answer? A patient was treated with psoriasis. A patient of psoriasis was treated with steroid. On stopping the treatment, he develops fever, malaise and lesions as shown in the image below. What is the most probable diagnosis? Very correct. The answer is option number 4. The answer to this question is option number 4, that is acute generalized pustular psoriasis. Now, we never give steroids in a patient of psoriasis, because when you give steroids, nothing happens when the steroids are given, but the problem starts when the steroids are withdrawn. Whenever you have withdrawal of steroid, at that the problem starts. And what is the thing, or what is the feature which occurs here? Patient either develop pustules, which is known as pustular psoriasis, and patient can even develop a generalized erythroderma, which is known as erythrodermic psoriasis, So you have pustular psoriasis and you have erythrodermic psoriasis. This is very, very important. And Rishi, you are absolutely right. Steroids are only indicated when you have severe form of psoriasis in a pregnant patient. Otherwise, you will not give systemic steroids in a patient of psoriasis. You prefer using topical steroids but never systemic steroids in psoriasis. All of the following infections presents with maculopapular rash except Rishi, Benedict, Himanshu, Rajneesh, Shriyam, Pranav, Medico, Smith. Please give me the correct answer here, everyone. Anyone? Good, very nice. Now this is a patient with shingles which never presents with maculopapular rash. You will have grouped vesicles which are present on a single dermatome in the patients of shingles. What is shingles? It is nothing but herpes zoster. So the correct answer here becomes option number 3. A patient with flaccid bullous lesion involving the oral cavity and skin. She has lesions as shown in the below picture. Acantholytic cells are seen on the Tzanck smear. What is the most probable diagnosis here? Pemphigus vulgaris, bullous pemphigoid, pemphigus foliaceus or dermatitis herpetiformis. Which of the following is the correct answer here? Pemphigus vulgaris, bullous pemphigoid, foliaceus or dermatitis herpetiformis. Jyoti, Smith, Benedict, absolutely right. Now I always tell my students to remember few points. Let me mark that for you. The first and the foremost is the nature of bulla, which is flaccid. If it is flaccid means the level of split is inside the epidermis, intraepidermal split. Whenever you have flaccid bulla, it means you have intraepidermal split. Okay? The next thing is you have to look for the features where you have involvement of the mucosa. Because intraepidermal split or intraepidermal split with oral mucosal involvement or any other mucosal involvement, you are clear with your diagnosis of pemphigus vulgaris. But if a patient has flaccid bulla without mucosal involvement, can you tell me what will be the diagnosis then? If the mucosa is not involved but still the bulla is flaccid, very nice. In that case, the diagnosis becomes pemphigus foliaceus. So amazing, all my students. I think you all are getting the clue or how to solve the questions on vesiculobullous disorders. Now please remember, my FMG students, that vesiculobullous disorder topic is a very, very important topic. It's a very, very important topic, so we cannot miss the chance of completing it. Okay. Now let's move to the next question. Please tell me the correct answer. Anyone can tell me the correct answer here? Nice. Desmoglein 1 versus desmoglein 3 differentiation. Okay. So Rajneesh, this is a very important difference. So this is for Rajneesh. You are asking the difference between desmoglein 1 and desmoglein 3. Now first of all, you should know what is desmoglein. Desmoglein is component of a intercellular glue which is known as desmosome. It is a glue which is present between the two adjacent keratinocytes. Now desmosomes are present throughout the epidermis. For example, it is present in between the cells of stratum corneum. It is also present in between the cells of stratum granulosum. It is also present in between the cells of stratum spinosum. Like this, also present in the stratum spinosum, and it is also present between the stratum basale. So desmosome is present throughout the thickness of the epidermis. But the desmosomes which are present in the lower dermis, they have desmoglein 3 as a component, and desmosomes of the upper dermis have desmoglein 1 as its component. In the patients of pemphigus foliaceus, they develop antibody against IgG antibody against desmoglein 1, and that is why they have subcorneal split. In the patients of pemphigus vulgaris, they have IgG antibodies against desmoglein 3 more frequently compared to desmoglein 1, and that is why they have suprabasal split. Is that clear, Rajneesh and other students? Clear? Is it clear? All my students, I want a quick thumbs up. This is very, very important concept. If you are understood this, or if you are clear with this, it's a very important thing. Now the answer for the question given on the screen is option number 2. Please remember, psoriasis is associated with metabolic syndrome. The next question is on your screen. Option number 2 is the answer to the previous question. Please tell me the correct answer of female with a foul smelling greyish white discharge. On examination, one of these will be seen on microscopy. What is the diagnosis? Anyone can tell me the correct answer? Can you tell me what is the diagnosis here? What is the diagnosis in this patient? In this patient, the diagnosis which we have is bacterial vaginosis. The diagnosis which we have is bacterial vaginosis. Now, bacterial vaginosis, it occurs because of mixed infection. When the count of lactobacilli goes down, the lactic acid is reduced and the pH of the vagina increases. The environment becomes very suitable for the growth of other pathogenic organisms. Now, when you do a microscopy, you will see multiple vaginal epithelial cells in the vaginal discharge, and all these cells have a lot of bacteria on its surface, not inside, on its surface. So, this epithelial cells with bacteria on the margin, these epithelial cells with bacteria on the margin, what is it called as? What is it called as? It is called as a clue cell. It is called as a clue cell. Okay? So epithelial cell presence with the bacteria on the margin is known as clue cell. Is that clear? Abha, Rajneesh, Jyoti, Smith, Benedict. Can I get a quick thumbs up from all my dear students? Next. A child with a bald patch on the scalp with easily pluckability of hair. Physician noticed a black dot on the areas of alopecias, and the treatment which you will like to give in this patient will be, treatment to be given will be amphotericin B, fluconazole, griseofulvin or cyclopyrox. So what is the answer? I request all of you, if you are targeting the FMG exam, I request you to please do a lot of MCQs, because we don't have much time right now. So the only way you can increase the confidence for your exam, or you can just find out what is the weaker areas, try to do a lot of MCQs. Okay, and if you want to go for PYQs, you can just simply get Unacademy Lite subscription using the code CHESTA10. You can just go for Unacademy Lite subscription. Unacademy Lite subscription. Clear? Benedict, Rajneesh, Abha, Rishi, Smith. The answer to this question is option number 3, because this is a very classical example of tinea capitis. It's a very classical example of Tzanck hepatitis, and the antifungal drugs which you will give is griseofulvin. The antifungal drugs which you will give is griseofulvin. Because griseofulvin works very well, this is actually an example of non-inflammatory black dot tinea, which is also called as what? Endothrix variety. All these features are very, very important, so please try to remember it. An alcoholic male presents with lesions as shown. He also has diarrhea. Deficiency of what is associated with it? Deficiency of what is associated with it? An alcoholic with lesions as shown. He also has diarrhea. Deficiency of what is associated with it? Very nice. Smith, trypto, very nice. The correct answer is tryptophan. This is an example of pellagra. And what is the classical tetrad of pellagra? We have first 3Ds, which includes dermatitis, which is a photodermatitis. Now this dermatitis is actually a photodermatitis. Then you have diarrhea and you have dementia. And if the patient is not taken care of, it can end up and can have death. So please remember all these features of tryptophan deficiency. Tryptophan is actually a precursor of niacin. And niacin, which is vitamin B3, is actually responsible. The deficiency of niacin is actually responsible for development of pellagra. Is that clear to all of you? Rajneesh, Rishi, Smith, Benedict, all of you. The next question is on your screen. Ulcer with the overhanging and undermined edges in the neck region is shown as below. They are present around some nodular structures. So these are TB lymph nodes. And the infection have extended onto the overlying skin. Extension on the overlying skin, very important. There is an extension on the overlying skin. So the correct answer of this question is option number 1, that is tubercular lymph node. That is tubercular lymph nodes. Is it clear or not? Can I get a very quick thumbs up from everyone? Which is also known as scrophulosderma. The correct answer of the previous question can also be scrophulosderma. Which mineral deficiency can lead to very classical dermatitis? This is a periorificial dermatitis around the mouth, around the genitals. Periorificial dermatitis. Very classical periorificial dermatitis. Which mineral deficiency can lead to following conditions? Zinc, iron, calcium or vitamin A? Anyone? Very nice. It's a patient with acrodermatitis enteropathica. And you see that in addition to dermatitis, they have alopecia and they have presence of diarrhea. So all these features usually comes in combinations. First line treatment for acne comedones. What will be the first line treatment for acne comedones? Topical steroids, topical antibiotic, benzoyl peroxide or topical retinoid? Anyone? Yes, good. Now please remember, comedones is actually a grade 1 acne. Comedone is actually a grade 1 acne, and the only problem which we have with a comedone is you have obstruction to the follicular outflow. Now our main approach should be to remove this obstruction. This can either be removed mechanically with the help of the comedone extractors, or we can use some chemical agents which are keratolytic in action. The keratolytic drugs which is given here is option number 4, topical retinoids. We have two types. One is edapalin and another one, the next one is tretinoin, which comes in different percentage. Okay, is this clear to all of you? Now identify the condition shown in the image. Anyone? Identify the condition shown in the image: malignant melanoma, BCC, squamous cell carcinoma and Nevis. Now all my students who are targeting FMG exam, please remember, every year we are getting one question from cutaneous TB. Cutaneous malignancies. So try to prepare yourself. There are total 3 malignancies which you need to do. There are 3 cutaneous malignancies. One is malignant melanoma, second is basal cell carcinoma, and third is the cutaneous T-cell lymphoma, that is mycosis fungoides. Try to read all these 3 in detail because we are getting one question. They are most frequently image-based question, but still you need to know them in little bit of detail. The answer here is option number 1, that is malignant melanoma. And this variety of malignant melanoma is lentigo maligna, which is seen in the elderly individual on the sun exposed site. What are the other variants of malignant melanoma? We have superficial spreading type, which is more frequent in the covered part. Then we have acral type, which is seen on the acral areas, and then the last one is the nodular type, which has a deeper component and it has a poorer prognosis. This is a very classical example of lentigo maligna, which is also known as Hutchinson freckle, Hutchinson's freckles. Okay, so please remember all these alternate names. Okay, yes, you can use A, B, C, D, E as a criteria here. How to differentiate between SCC, BCC, malignant melanoma? Sushma, I will be taking a plus class on 29th of this month. So if you want to read the differences between, or if you want to read cutaneous malignancy in detail, please go ahead and get your subscription using the code CHESTA10. Please get the subscription using the code CHESTA10. I will be telling you this in detail. Okay? Is that clear? Anyone has any confusion? Okay. Now let's move to the next question. Which organism is responsible for causing erysipelas, streptococcus, staphylococcus, bacteroides or fungus? Which organism is responsible for causing erysipelas? Anyone? Anyone can tell me the answer? Tell me what is there in this question. Just tell me what is there in this question. You can see that there is erythema on the face, and this erythema is actually extending onto the ear. So what exactly is this? What is happening here? Which organism is responsible for causing erysipelas? Amazing. The correct answer here is option number 1. Now this is a patient with a very classical million ear sign. Please remember, erysipelas involves the ear pinna, but if you have cellulitis of the face, the ear pinna is spared because you don't have subcutaneous tissue in the ear pinna, and cellulitis is the infection of the subcutaneous tissue. So please remember, this is a very classical image. Now here, why the color is pink? This is because of the effect of the light of the camera. Please remember, you just see a erythematous appearance of the ear. It is not pink, it should be red, but this is a camera effect, the light effect, and that is why it appears very different here in this picture. Okay, and the most common organism causing erysipelas is streptococcus. Cutaneous horn, as shown in the image, is associated with which of the following skin cancer? This is a previous year FMG question only, last to last year I guess. Cutaneous horn is shown in the image, associated with which of the following skin cancer? Nice. I think it's an easy one. So cutaneous horn, as shown in the image, is associated with which of the following skin cancers? Please remember, the correct answer is squamous cell carcinoma. Now per se, cutaneous horn is a benign condition, but if you have a long standing cutaneous horn, it can get converted into malignancy, that is squamous cell carcinoma. And that is why whenever you have a patient of cutaneous horn, you always advise excision, and you send the biopsy, send the sample for the histopathological examination or for the biopsy. Okay. Okay. So identify the condition shown in the image. I think instead of knowing the type of the exam, it's better if you prepare yourself 100%. Now there are many students who always ask me that, ma'am, like what type of questions we will get, and will it be simple paper or difficult paper? Okay, so I would only request my students to concentrate on your preparation. If your preparation is 100%, the question paper will be easy for you. But if your preparation is zero, obviously the question paper becomes difficult for you. So it is, if you are read enough or if you have prepared enough, I think it is average for everyone and you can easily solve them. Okay? This is a very classical example or image of condyloma acuminata, which is human papilloma virus 6 and 11. Human papilloma virus 6 and 11. Patient suffering from ulcerative colitis presents with ulcer on the anterior leg as shown in the image. What can be the diagnosis here? What can be the diagnosis here? Anyone can tell me the answer here? Very nice. Now in this question you see that there is a very rapidly progressing ulcer with a very characteristic violaceous margin, and if you concentrate over this part, you can see a cribriform type of scar. This is a very classical example of pyoderma gangrenosum, which is neutrophilic dermatosis. It is neutrophilic dermatosis. It is neutrophilic dermatosis. Common complication associated with the following condition, what would be your answer? Which is the common complication associated with this? Post-streptococcal glomerulonephritis, staphylococcal scalded skin syndrome, encephalitis, pneumonitis. What is the correct answer? What is the correct answer here? Post-streptococcal glomerulonephritis, staphylococcal scalded skin syndrome, encephalitis and pneumonitis. Very nice. The most common complication associated here is PSGN, and the most common strain. What is this? This is actually an example of non-bullous impetigo. And in this image you can see that there are honey colored crust. We have honey colored crust which are present. Honey colored crust, and this is a patient of non-bullous impetigo. Now the strain of Streptococcus M49, it very frequently causes the PSGN. So whenever you get a patient with history of sore throat, ear infection, following which there is sudden edema or ascites like features, think of the PSGN. Okay. Next, tourist guide in in the Mount Everest, after one of his trips, developed blisters on the feet. What is not useful for this patient's treatment? Anyone? Amazing, amazing. Hyperbaric oxygen, aspirin, phenylephrine or pentoxifylline. What should be avoided or what should not be used? The correct answer of this question is option number 3. Now what is this? This is actually an example of frostbite. And I think everybody knows that frostbite occurs because of sudden vasoconstriction. So whenever you have increased temperature of the outside environment, what happens? The body tries to conserve the temperature, or it prevents the heat loss by constricting the blood vessels. Now the problem occurs in the end arteries, where the only one nerve which was supplying, or only one artery which was supplying the distal part, it gets vasoconstricted. So when that artery gets vasoconstricted, the nutrient supply, the oxygen supply to the distant part is compromised, giving rise to buildup of carbon dioxide and the free oxygen reactant. These will then cause damage to the skin, causing blisters. So for treating frostbite, our main aim is, first of all, definitely you have to ask the patient to move to the warmer environment. Second, you will give the drugs which increases the blood flow by causing vasodilatation, by preventing the formation of thrombus, and by supplying more and more hyperbaric oxygen to the distant part. So everything will be given except phenylephrine, which is actually a vasoconstrictor. Okay. Chilblain is very similar to that of frostbite. Okay. So in chilblain also the patient has pain secondary to the vasoconstriction, which occurs because of reduced outside atmospheric temperature. Clear? Now with this we are done with the today's session. I hope everybody have enjoyed. I request all of you to please subscribe this YouTube channel, that is Unacademy Live YouTube channel. You can use my code Chesta10. You can use my code Chesta10 and get yourself enrolled into Unacademy. Please hit the bell icon so that you get all the notifications of my classes. And if you want me to take any more sessions, you can write on the comment section below. Don't forget to press the thumbs up so that more and more likes occurs in this video.